The U.S. could be seeing the start of a fourth wave of the coronavirus. More than 52,000 new cases were reported Wednesday. That means infections have more than tripled in the last month. The Delta variant is driving the summer surge, and the head of the CDC warns it's, quote, more aggressive and much more transmissible than previous strains. Meanwhile, vaccinations have plummeted since the April peak. The country is now averaging fewer than 400,000 doses per day. Less than 50% of the population is fully vaccinated. And now the NFL is pressuring its players to roll up their sleeves. David Begnaud is in Louisiana with more. David?
Right after the NFL made that announcement, a player for the Seattle Seahawks came out and said, I just went and got vaccinated because I don't want to hurt my team. The NFL has told players you must be vaccinated by the time the season starts on September the 9th. Tonight, a warning from the NFL to its teams. If there's a COVID outbreak and players are not vaccinated, prepare to forfeit and lose the game. The league has tried to get players immunized. 78% have gotten at least one dose. The NFL commissioner sent out a memo saying that any team which causes a game to be canceled will be responsible for financial losses, and players on both teams won't get paid.
They're hoping as players begin to report to training camp this week into next week that they'll start getting vaccinated so that they can meet that sort of threshold that they've all set for one another, around 85% or so for all teams.
Deandre Hopkins, one of the players who says he won't get vaccinated, tweeted this: being in a position to hurt my team because I don't want to partake in the vaccine is making me question my future in the NFL. This comes as the Delta variant is raging nationwide. More cities are now urging residents to mask up, and tonight the president is speaking up.
We follow the science.
Take Louisiana. Over the last week, they've seen their biggest increase in hospitalizations since the spring of 2020. This is in a state where just over 1 in 3 people are fully vaccinated.
I was 100% hesitant. I did not want to be a guinea pig.
Catherine Templeton is a nurse practitioner. What changed your mind?
Watching people die, watching people have life-altering illnesses, they'll never be the same. There's folks who are my age. They're in the hospital now.
For many, it's too late.
I begged him. I said, you need to take the vaccine, Brandon. Oh, no, Mom, I'm not going to take it. And you bet not take the vaccine either.
Betty Antoine's son, Brandon, died from COVID. He was 46.
He would say, look, it's not enough research, and we don't know what's in that.
Where was he getting his information from?
Google, and he listened to the news. And
Antoine, a teacher, delivered a lesson to her community. She turned Brandon's memorial service into a vaccine drive. 3 people got vaccinated on the spot.
My son is dead right now because he didn't believe in the vaccine. He's dead.
You know, it's interesting. As the cases are rising here in Louisiana, so too is the vaccination rate. Also, we're at Our Lady of the Lake Regional Medical Center here in Baton Rouge, which is the largest bed count-wise in the state. And a short time ago, the spokesperson told us that they're at capacity. In fact, he said we are crushed in the emergency room. And they're actually figuring out how to go on the local news tonight to tell people, listen, please don't come to the hospital unless you absolutely have to and have some type of life-threatening condition. That's the situation tonight in Louisiana's capital city. Lana, back to you.
David, thank you for getting that message out. There has been a recent rise in reports of fully vaccinated people contracting COVID in the U.S. Experts say the so-called breakthrough cases aren't uncommon, but they can sometimes be fatal. CBS News Chief Medical Correspondent Dr. Jon LaPook reports.
It was a hippie fest where people were close and hugging. And
Jeff Friedman and Julie Greenhouse were among the fans at the crowded Peach Festival in Scranton, Pennsylvania. 16,000 faces and not a mask in sight.
It didn't really occur to us that we were putting ourselves at risk. It was we were outside, we're all vaccinated.
But vaccinations were not required. 48 hours after that last curtain call, Greenhouse developed symptoms and tested positive for COVID with a breakthrough infection. So did her boyfriend Jeff and 13 other festival friends, all with mild symptoms.
I think if I had thought it through that I could have gotten COVID from someone unvaccinated, I would have been smarter.
Dr. Paul Dupre is a vaccine researcher. He says it's crucial for people to get vaccinated so there's less virus to mutate into a more infectious version like the Delta variant, which has likely been causing the increased reports of breakthrough cases. Compared with previous versions of the virus, there's evidence Delta may attach to lung cells more efficiently. And a recent study found the Delta variant produced about 1,000 times more virus in the nose than the original strain.
It's not just about staying out of hospital and staying out of a coffin. It's about stopping the likelihood that that virus will change.
So far, the COVID vaccines have been highly effective at preventing serious illness, even from Delta, but they're not perfect. According to the CDC, millions of vaccinated people will be at risk of a breakthrough infection if exposed, but so far, most have had mild or no symptoms. Out of more than 160 million fully vaccinated people in the U.S., the CDC says 5,500, mostly the elderly or people with underlying health conditions, have been hospitalized or died. Lana, the CDC is looking into rare cases of vaccinated people infecting not only unvaccinated people, but people who have been fully vaccinated. But CDC head Dr. Rochelle Walensky emphasized to me yesterday that the vaccines continue to provide exceptional protection against severe illness or death.
Dr. Jon LaPook, thank you. For more now, I want to bring in Dr. Hlatshwayo Davis. She's an infectious disease physician at Cochran VA Medical Center and a member of the St. Louis Board of Health. Dr. Hlatshwayo Davis, thanks for being back with us. As we just heard, the CDC says that millions of people could experience breakthrough infections, but experts say the only way out of this fight is through vaccines. What do you say to people who may be watching right now who are hesitant to get vaccinated because they think they could still be infected either way?
Thank you for asking this important question, Lana. I'm getting this question in my own personal life so much because for people, I think they start to think about this in absolutes, and you can't. So are we going to see people, despite getting vaccinated, will get COVID? The answer is yes. But when you look at the percentages, let's look at that very clearly right now, actually. So over 98% of people who have gotten new cases of COVID in the last month have been unvaccinated. When we look at hospitalizations, that number goes up to 99%, and the same with deaths. So what that tells us is vaccines work, and where there are breakthrough infections, they are minimal. So you should be motivated to take the vaccine because it highly is likely to prevent you from getting COVID. But even when you do, it prevents you from being hospitalized and dying. And I have seen this for myself. Folks who otherwise, because of their age, because of other health conditions, who got the vaccine and developed COVID are at home with it. Inconvenient, but alive. Inconvenient, but not with long-term symptoms. Folks who don't get the vaccine don't have those assurances.
Inconvenienced versus not being alive puts it into pretty clear terms for us. The head of the CDC says that the Delta variant is, quote, one of the most infectious respiratory viruses that she's seen in 2 decades. Explain how dangerous is this point of the pandemic that we're in, and how do we come out of it?
So unfortunately, what's happening with the Delta variant is a natural sequela of virology. Viruses, by definition, will mutate. Some of them have mutations that are not concerning. But as we've seen since about December, the mutations that started to permeate within this family became dangerous. We saw them coming out of the United Kingdom, South Africa, and now this highly transmissible Delta variant, which we know is 50% more transmissible than any other strain out there, and which accounts for the majority of new cases across the country. This is serious, and it means that those people who are still on the fence or who feel that they don't want to get the vaccine should really take pause and reconsider this, because we're dealing with a variant that is even worse than what we've dealt with. And I think we can all agree that what we've all had to endure over the last year and a half has been bad enough.
Yeah, and I recall us having this conversation about vaccines being able to help slow the spread of mutations that could be dangerous well in advance of where we are right now. As Delta spreads, the CDC and other health officials say that there are no current plans to update federal mask guidance. Remind our viewers what that guidance currently is, and looking a bit into the future, do you foresee more cities and states needing to make changes to that on a local level?
So in a simple level, the masking mandates that were announced by the CDC were that for vaccinated people, with a few exceptions, masking is not necessary. But for unvaccinated folks, masks should be worn indoors. And that guidance around social distancing, hand washing, and et cetera should still be maintained both indoors and outdoors. There were some exceptions around people who are immunocompromised, et cetera. But it drew a line in the sand and said, because of available data, we know that vaccinated people are not at great risk, whereas unvaccinated people are at risk, both to themselves and those around them. But with cases now, with surges across the country that are attributable to the Delta variant, people are understandably concerned. And currently, the CDC's take on this is that they will reevaluate the guidance if the science requires them to do so, but that individual jurisdictions have to make the decisions about changing their policies or implementing mandates based on their own case positivity rates and what's happening within their jurisdictions.
Dr. Hlatshwayo Davis, we have talked in the past about what other countries are doing and what they're experiencing. Both France and Italy are requiring people to provide health passes to enter most public venues. After the decision was announced in France, millions of people lined up for their first vaccine dose. Why aren't we pursuing anything similar in the U.S.? And do you think that that's hurting our fight against the coronavirus?
Well, I believe that the administration has done a phenomenal job of addressing this, is really trying to prioritize where we are. But as far as passports go, I do believe from my contacts that this is something that is being discussed, that the risks and benefits are being weighed. I do believe that we are a global society and that travel and the ability of not only people, but the viruses they may or may not carry, put us all at risk. And so we need to be thoughtful about what the best strategy is to be able to screen folks. Now, there are public health measures that we can take. We can, as we did early last year, we were requiring quarantines. We did a lot of things to order to mitigate that. And I suspect that this conversation is ongoing and will continue to be explored as we continue to open up more.
Well, the CDC is warning of a, quote, potentially more severe flu season after hitting historic lows in early 2021. Why is that? And is there any way to avoid it?
You know, it's interesting. When one virus flourishes, what we benefited from in the pandemic was that a lot of the mitigation strategies that we put in place made us see a much less severe flu season. And that was a relief to us all because, quite frankly, COVID was more than enough for us to handle. But having said that, we're seeing in hospitals right now a lot of other viruses now come into play as the year progresses. And so we're seeing, parainfluenza and other minor viruses in numbers that we haven't seen all year. So it makes sense that we would prepare for a more significant flu season, especially because all of those mitigation factors that we put in play, masking mandates that no longer exist in most places, that's really what kept these other viruses, particularly influenza, at bay. And so we need to be prepared. And additionally, we are opening up in places where these viruses flourish. And I'm thinking specifically about schools, places of higher education, and of course, businesses. And so it makes absolute sense that we be prepared and that we continue to push for the flu vaccine that has done so much to limit the lives lost to influenza over the last decades.
All right. Dr. Hlatshwayo Davis, thank you for joining me, and thank you for all that you do.
Thanks for having me, Lana.